So a couple of days ago, Novavax and Johnson and Johnson, or and Janssen and Johnson worked together on a vaccine. It's a little confusing because their names are very similar. But anyway, Novavax and Johnson announced kind of preliminary results of their phase 3 trials, and I think that there's a lot of good information in their press releases. So I think we should go over them together. So this is Novavax's um, release. Let's see. Let's go through here. So as you know from the previous video, this is the vaccine that I was hoping to get, but they just weren't out to market by the time that I needed the vaccine for work. So I ended up getting the Moderna. But this is the one that uses a full-length pre-fusion spike protein, and then they use an adjuvant with it. So it's basically a protein vaccine with an adjuvant, which is a very well-known and well-characterized vaccine technology. Um, and it's used for like tetanus vaccines and things. So this is a very well established vaccine technology and is very safe. So that's the one we were looking for, that I was looking for, but it's currently still in the middle of their phase 3 trials. So UK phase 3 results, 93.3% efficiency. The study enrolled more than 15,000 participants between 18 and 84 years of age, including 27 over the age of 65. The primary endpoint based on the first occurrence of PCR confirmed symptomatic COVID-19. So this is very mild, moderate, or severe. This is very same endpoints as the Moderna and the Pfizer trials. They're looking for symptomatic PCR confirmed COVID-19 infections. They are not looking for asymptomatic. So their trial does not look like they'll be able to answer the question of asymptomatic transmission. So can you still transmit the disease asymptomatically after you get the vaccine? They did not test for that. First interim analysis based on 62 cases. So 56 cases were observed in the placebo group and 6 observed in the vaccine group. So that's similar to like the Moderna or Pfizer trials. They had about 170 in the placebo group and like 10 in the vaccine group. So this results in an estimate of vaccine efficiency of 90% or 89.3%, which is very similar to the 94 or 95% of the mRNA vaccines. Preliminary analysis of that the UK strain was increasingly prevalent was detected in 50% of our PCR confirmed symptomatic cases. So basically, what's important about these trials is these trials are occurring at the time that all these variants are spreading through the population. So we can see how well do these vaccines protect against the variants. And since all these vaccines are using a pre-fusion stabilized full-length spike protein, so Moderna, Pfizer, Novavax, Johnson, they're all using the same protein, I would expect their efficacy to be similar against the different strains. So about 50% of the infections that they got were the UK variant. So based on PCR performed, they said that it was 95%, 95.6% against the original strain and 85.6% against the UK strain. So that's good news. That means the UK strain is just as well protected basically as the wild type strain, the original strain, by this vaccine, and likely the same case for the mRNA vaccines. And that's kind of what we knew from the previous information about the antibody testing and the sequence and the mutation analysis of the different mutations that the virus can take in the spike protein. The UK strain did not have the mutation in the 484 position. That's the one that was thought to cause some antibodies to not bind and recognize the protein as well. So that makes sense. Interim analysis included preliminary review of the safety database. Okay, so they found that there weren't any big safety issues, so they're very happy about that. Here's the more interesting stuff. In the South, so they also had a trial. They had a trial going in the UK, and they have another trial going in South Africa. In the South Africa phase 2b clinical trial, 60% efficacy for the prevention of. So, and look at this confidence ratio; it's really huge, 20 to 80%. So, this must be very small numbers for them to have such a large confidence interval. So the prevention of mild, moderate, and severe COVID-19 disease. Most of them were COVID negative, were HIV negative. So 29 cases observed in the placebo group and 15 in the vaccine group. So you see that the differences are not that big, which is why you only get the 60% efficacy. One severe case occurred in the placebo group, and all other cases were mild or moderate. Um, so when they did sequencing data that was available for about a little over half of the infections that they got, 92% were the South African variant. So basically, this 60% efficacy is the efficacy against the South African variant. And that shows that the South African variant, so the wild type was 95, UK was 85. The South African variant is probably 60%. So as expected from the information that we had before about the 484 position mutation, that one does seem to make that variant not as efficiently protected by the vaccines. And this is probably holds true for all the other vaccines since they're using all the same target, which is the full-length spike protein. So, before in the previous video, I said, we can't put too much stock in all the antibody studies because they don't, there's no input from the cellular immunity source, the T cells. Maybe they work a different way and they would help attack the South African variant. That appears that it is probably not the case, unfortunately, and the vaccines are significantly less effective against the South African variant. So 60% reduced risk. They're trying to spin this as a good thing, and 60% isn't nothing. It's better than 0% for sure. Okay, so that's their thing. So the take-home points: UK variant seems to be pretty well protected, not a big difference. South African variant significantly less, so it drops from about 95 to 60% efficacy against the South African variant, and this is the kind of rubber meets the road study where they're not looking at antibody, they're not looking at epitopes, they're just looking at do people get the disease, which is what we really want to know, and that would test the protection from both humoral and cellular immunity. So there is no rescue from cellular immunity that makes it really good. It's 60%. All right, so let's look at the Janssen trial, which is the Johnson & Johnson and Janssen Pharmaceuticals work together. They have a much larger trial going, 44,000 adult volunteers across the world. And the vaccine was 66% effective at preventing the study's combined endpoints of moderate or severe disease. This is kind of interesting. Their endpoint was moderate to severe. I suspect they're changing it to moderate to severe, or they're reporting data on that because they must have not been able to protect against mild COVID very well. And it was probably even worse than this. And so moderate COVID-19 means that you were definitely symptomatic, you had difficulty breathing. This is probably, where some people might have had to go to the hospital or at least be on oxygen. Severe means that you were in respiratory failure, shock, organ dysfunction, ICU admission, or death. So severe is really bad. Moderate probably means you were in the hospital for a day or two, or at least on oxygen. So this is, significant disease. They didn't even follow mild disease. So I suspect their level of protection for mild disease was even worse. So in terms of level of protection, there was differences in how efficient it was based on where the study was being done. It was most effective in the United States, less so in Latin American countries, and less so in South African countries. This is probably not the result of different genetics in the area of the people. It probably has more to do with the variants of the virus that are present in the areas. So the South African variant probably, this is, represents most of the ones here. There's probably a Brazilian variant component that's looking at this number, and this is probably mostly the close to the original strain. The Johnson and Johnson, the Janssen vaccine is it's a adenovirus vaccine. So here we go. This is a recombinant replication incompetent. That means the virus cannot replicate. They've disabled the replication function of the adenovirus. Adenovirus is a DNA virus, and they put the spike protein, the full-length stabilized SARS-CoV-2 spike protein. So this is the same thing that Novavax used, full-length pre-fusion stabilized SARS-CoV-2 spike protein, and that's the same thing that Pfizer and Moderna used. So and this is a single dose, so that's kind of the advantage. And the other advantage of these adenovirus vaccines are they're much more stable, and so you don't need to freeze them at like -80 degrees or -20 degrees like the mRNA vaccines. They can be just refrigerated, and they last for like 6 months, even at refrigeration temperatures. There was a point in here, I think, where they talked about. I thought they talked about how the South African one was mostly the South African variant. But anyways, I think this number, the 57% and the 60% in this number is very similar. So both trials show that the South African variant is not very well protected, at least not as well protected as the original strain. The original strain, the vaccines are very effective at preventing infection from them. The South African variant, significantly less so. Probably looks like 40% less effective. So that's just like the video we talked about before. We're in a situation where the virus is pretty widespread in the world population, and so there's a lot of replication going on in hosts, and that gives you a lot of chance for mutations to happen. And now we apply selection pressure of these vaccines. It's pretty likely, I think, that there will be a variant that's even more successful at immune escape than the South African variant down the line. I hope that's not true, but I wouldn't be surprised if that's the case. So they're either going to have to make another vaccine if they find one that drops the efficacy of these vaccines even further, or we're going to have to find a better treatment for this thing. Okay, so anyways, this is kind of the information that we wanted to know. Do the vaccines work against the new variants? Now I think we have pretty good information to say, yes, it works well against the UK variant, and it does work against the South African variant, but significantly less well. And while we don't have this information for Moderna and Pfizer, there's good reason to believe that since they're using the exact same target, that their efficacy would be exactly the same. All right, thanks for watching. Any questions or comments, please put them below.